Any pain in your lower back?
A little bit.
Where?
This lower part, yeah.
Just across?
Yeah.
Okay. If you get any lower back pain? Anything?
Just a little bit from the training.
Any sensitivity when I do this?
No.
Hold. See the difference?
Mm-hmm.
I'm able to overpower you quite easily. See that?
Yeah.
Hypertonicity of the paraspinal muscle on the right side as opposed to the left side. How's that? It's okay?
Yeah.
Are you gonna go easy with me tomorrow?
Of course not.
Inhale and exhale. Inhale and exhale. Inhale, exhale. If you're good, drop your head back. Whew, this is going to be hard work. What's up, everybody? Dr. Ranen here. Today we're with Stanislav Tarailo. Stanislav, also known as Stan, is currently one of my coaches. We're actually both being coached by the same person in terms of our diet and exercise prep, etc. But Stan has been doing my workouts with me over the last couple of months. He is a competitive bodybuilder. He competed at IFBB World Championships last year as well as Arnold Amateurs, and he's currently in his off season. Stan is from Serbia. He's never been to a chiropractor before, so we've been chatting over the last couple of weeks and we finally managed to get him in. He does not have any injuries at the moment, which is fantastic, but we're going to do a general screen and see what we can find. We're going to look to find any mechanical dysfunction or any muscular dysfunction and try and correct it. All right, let's go in. Let's get going. Don't forget to hit the subscribe button, guys. Your support is always greatly appreciated. Okay, let's check if your nervous system is working. Good. Hands for me, please. Hands on your hips. Great. You want to pop your shoes off for me, please? So guys, as always, for those of you who watch my videos, regardless of whether a patient presents with neurologic symptoms such as nerve pain, numbness, weakness, we always start our spinal assessment with dermatomes, myotomes, and reflex, or basic neurologic examination. Do you feel this?
Yeah.
Same both sides?
Sure.
Here?
Yep.
Here?
Yeah.
Okay, hands please. You feel that?
Yeah.
Here?
Yeah.
Here?
Mm-hmm.
Here?
Yeah.
Here?
Yeah.
Here? Here?
Yeah.
Here? All right, lift your toes up for me, please. Lift up, hold. Good. Lift up, hold. Good. Bend down. Hold. Good. Hold. Good. Okay. Squeeze for me. Squeeze, squeeze, squeeze. Good. Turn your hands over. Lift your fingers up. Hold. Don't let me push down. Good. Make a fist for me. Lift your wrist up. Hold. Don't let me push down. Good. Hold for me. Don't let me push down. Good. Turn your hands over. Lift your wrist up. Hold for me. Don't let me push down. Good. Hold for me. Don't let me push down. Good. Okay. Hold here. I'm going to turn in. I want you to resist, okay? Good. I'm going to turn over. I want you to resist. Good. I'm going to turn in, resist. I'm going to turn over, resist. All right. I have to stand for this one because you are quite big. All right. Just contract the bicep for me. I'm going to push down. I want you to resist. Good. Relax. Same thing. Hold for me. Good. Now I'm going to push up. I want you to resist. Good. This side. Hold. good, relax. Hold, good, relax. Hold, I'm gonna push up now. Resist. Okay. Let's get you to stand for me, please. You're gonna face that way. Okay. Any pain in your lower back?
A little bit.
Where?
This lower part, yeah.
Just across?
Yeah.
Okay. Any pain here?
Not really.
Any pain here?
No.
Any pain here?
No.
Any pain here?
No.
Okay, bend forward for me slowly, please. Tell me if you get any lower back pain. Anything?
Just
No.
a little bit from the training.
Where do you feel it?
Yeah, in the lower part.
Running across?
Yeah.
Okay. Stand for me. All the way up. Okay, you're gonna go down again and stop as soon as you feel it, please.
Okay,
Just at the bottom.
Just a little bit,
Okay.
yeah.
You're gonna stand for me. Let's get you to take a seat for me, please. Can you cross your arms for me? Hug yourself. All right. Let's bring this on. 1 second. There we go. Okay. Can you twist to the right for me, please? Any pain in the mid back, in this region here?
Not really.
No? Can you go the opposite way for me, please? Okay.
It's okay.
Sorry?
It's okay.
It's okay?
Yeah.
You have some limitation to the left. I'm going to move you, all right?
Mm-hmm.
Okay, that's much better. Okay. Bend to the right for me, please. Any pain?
No.
Bend to the left for me.
No.
You feel you can bend more to the left than you can to the right?
Not really. I didn't
Not
pay
really?
attention. Yeah.
All right, so try and go to the right for me again. Yeah, you seem to be a little restricted on this right side in lateral flexion and rotation. Okay, can you cross your fingers for me, please? Place them behind your head. Yeah, bend your elbows. Right, bend forward, and then I want you to sit up as high as you can and open your elbows for me. Open, 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 open. Any pain in the mid back?
No.
No? All right. Okay. Can you come back for me a little bit, please? Okay. Bring your elbows together for me. Whew, this is going to be hard work. This guy is big. Leave your body loose for me. There we go. Surprisingly, it moves quite well. Any sensitivity when I do this?
No.
Okay. Can you cross your arms for me, please? Yes. Bring this arm at the bottom, to the bottom for me.
Like this?
Yes. Okay.
Okay.
Any sensitivity?
No.
Nothing at all?
No, everything's fine.
You feel?
I feel, but everything is good.
What do you feel?
Just twisting. Nothing.
Just twisting?
Yeah.
Okay. Swap arms for me, please. Yeah. This one at the top, right one at the top, left one at the bottom. Okay. Yeah, that feels way smoother. Okay. Relax for me. Look up for me, please. As high as you can go. Any pain in the neck?
No.
All right, look straight ahead. Can you turn your head to the right for me? Any pain in the neck?
No.
Turn to the left. Any pain in the neck?
No.
Turn to the right again. Okay, look straight ahead. Straight ahead. Here we go. Bend your left ear to your left shoulder. Any neck pain?
No.
Right ear to right shoulder. Any neck pain?
No.
Okay. Let me move your head now. Any neck pain?
No.
Any neck pain?
No.
Here?
No.
Here?
No.
Here?
No.
Great. When I do this?
No.
When I do that?
No.
Okay. All right, let's get you to sit up for me. Let's do some muscle testing of your upper limb. So we're gonna test your trap, okay? Your trap meat. You're gonna look straight ahead. All right, you're gonna resist for me. I'm gonna push forward. You're gonna resist, okay?
Okay.
Let's go. Not bad. Let's try the opposite side. Hold for me. Not bad at all. Okay, let's go up here. Hold. I'm gonna push forward. I want you to resist. Okay. This side. Hold for me. I want you to resist. Okay. Do you feel a difference between the right and the left?
Not really.
Not really?
Do you?
Yeah. Hold for me. So here, when I push, hold, you're able to lock out immediately, okay? Here, when I push, hold, you're able to lock out immediately. But on this side, right, hold, see the difference?
Mm-hmm.
I'm able to overpower you quite easily. See that?
Yeah.
Okay? Let's get you to lie on your back for me, please. So that was your trap, min and mid, okay?
Okay.
Let's do your pec, oh sorry, your lat. Turn your wrist in for me. I'm gonna pull away. I want you to try and resist me, okay? Hold, nice and strong. Good, relax. Turn your wrist in. All right. I'm gonna try and push. I want you to resist me, okay? Hold, nice. Relax. Turn your wrist in for me. Hold. I'm gonna pull away. I want you to resist. Look at that. Turn your wrist in. Push towards your hip. Hold. Much better. We'll try that one more time. Turn your wrist in. Hold. Yeah. Okay, so that's your pec. We'll try your lat one more time. Turn your wrist in. Hold. And resist. Quite good. Okay. So, what is the significance of muscle testing for Stan as an athlete? The most important thing is we want to look for areas of potential dysfunction. In a bodybuilder or any type of lifter, rotator cuff injuries are very common. Lateral epicondylitis or tennis elbow is an issue. Wrist injuries such as intersection syndrome become an issue. That's going to affect his ability to lift and to train. That may affect his preparation for competition. So if we can identify areas of weakness and potential areas of biomechanical abnormality, we can rectify them in advance and stay ahead of any potential injuries that are or that can arise in the future. All right, let's test your muscle test your lower limb for me. You're gonna lie on your back. Okay, so let's get you to raise your leg for me. Hold. We're gonna test your quad. All right, just resist for me, please. Good. Turn your foot out. Hold for me. Resist. This is the psoas. Relax. Okay, I'm gonna push out. I want you to hold, okay? Like you're doing an adductor machine. All right, so that's your adductor longus and gracilis. Relax for me. Bend your knee. Now we're gonna test your adductor magnus. You're gonna keep your knee in this position. I'm gonna pull across. Great, relax. Okay, let's do the opposite side now. Raise your leg for me. Up, 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 up. Hold. Okay, I'm gonna push down. You're gonna resist, okay? Look at that. Okay. I'm not making this up, guys. I think you can ask Stan. Are you pushing as hard as you can?
Yeah. Let's try again.
Hold. All right, resist.
Okay.
Look at that. All right, that's your rectus femoris. Raise your leg for me. Turn your foot out. Hold. This is your psoas. Hold. Yep. Okay. Let's do your adductor now. Hold for me. I'm going to push out. Well, you can see he's really trying, but he's actually compensating to so much so that I'm able to move his entire lower limb. You want to try that again?
Okay.
Look at that. Okay, relax for me. Okay, keep your knee in this position. Let's check your adductor magnus. That one's much better. Relax for me. Okay, let's test the glutes out. Let's get you to turn over onto your side for me, please. Face that way. Lie on your side, please. Okay. Bend the bottom knee, straighten the top leg, straighten the top leg straight. There we go. You're going to bend this one here for me. Bend this one. There we go. All right, hold for me here. All right, I'm going to push down. You're going to resist. So that's your glute min. Okay. And then now your glute med. So straighten your leg. Come back. Come back for me a little bit. Hold. All right, I'm going to push down. Resist. Great. Can you turn over onto the opposite side for me, please?
Sure.
Okay. Bend your knee for me, please. All right. Lift your leg. Hold. Okay. Glute min. Resist for me. Not bad. All right. Come back for me. Bring this leg back. Straighten, straighten. Try and straighten your leg for me. Straighten. Yeah. Okay. Hold. There we go. Look at that. Let's try one more time. Try squeeze that glute med. Look at that.
Yeah.
Okay, relax. Let's get you face down, please. Okay, relax your legs. Now slight short leg on the right side. Let me get my trusty pen. Okay. Let's get you to raise your right leg from your hip and down. Left leg and down. Let's do right leg one more time for me, please. Up. Okay, and down. Left leg. All right, and down. So that's what's called a passive hip extension test. I use it to differentiate between subluxation or malalignment of the L5 lumbar facet joint and the sacroiliac joint. So when a patient raises their leg and one leg is higher or lower than the other, the lower side generally indicates a malpositioning of the L5 lumbar facet joint, and if there's a short leg like you see on the right side, that will generally indicate that it's a sacroiliac joint. You can, however, have a situation where a patient has a short leg on the same side that the passive hip extension test is lower. That will just mean that the leg length inequality is coming from that joint. Okay, so this is L4. We know it's L4 because it's the height of the iliac crest. This is L5 and this is S1. Okay. Any sensitivity here?
No.
Any sensitivity here?
No.
Any sensitivity here?
Just a little bit.
Just a little bit, okay. So sacroiliac joint out of alignment there, L5 out of alignment here. Which side is more sensitive, right or left?
Left.
Left. So it's pretty clear. This is why I like doing multiple tests, because I'm able to get an idea and then confirm. So one test may give me an idea of what's going on, and the next test that I do may confirm that idea or theory that I may have, which is pretty evident here. Any sensitivity? Oh, ticklish. Just ticklish. Yeah? Okay. We're going to start our muscle testing of the glutes and hamstring now. The left leg is the weak leg, and the right leg is the weak leg, and the left shoulder is the weak shoulder. So let's start here on the left side. Hold for me, please. I'm going to push down. I want you to resist. Good. Okay. You're going to do a hip extension now. Squeeze the glutes and lift the leg. Hold here for me. I'm going to push down. I want you to resist. Great. Relax. Okay. Bend your knee for me, please. Hold. Resist. Okay. Lift up for me. Hip extension. Hold and resist. Look at that. It drops down quite easily. You want to try that again, Stan?
Yeah.
Yeah?
Sure.
All right. Lift up. Hold. 1, 2, 3. Much better, but you can see how it just fails. Okay. Relax. So, it is not ironic that Stan is having weakness in the right leg and the left shoulder. If we observe his mid-back, what we see here is that he's got a significant hypertonicity of the paraspinal muscle on the right side as opposed to the left side. Even if we palpate here, it's tight, but when we come over to this side, it's very ropey, exceptionally ropey, very hard here. Do you feel the difference? Mm-hmm. Yeah. Now, what is the significance of this? The thoracolumbar fascia is a band of fascia that's found at the base of the lower back. And amongst other things, the thoracolumbar fascia is responsible for distribution of force between the lower limbs and the upper limb. There is a school of thought which states that the transition of force is opposite. So the right leg operates with the left shoulder and the left leg operates with the right shoulder. Now, the thoracolumbar fascia is not a muscle. It's not going to get into spasm, but it does overlie muscle. And tightness in the muscle and muscle spasm is going to cause tightness in the thoracolumbar fascia. If the fascia is tight, it's going to restrict its movement. And if the fascial movement is restricted, it's going to create this tightness and restrict the distribution of force between the two limbs. So a weakness in the lower limb due to a potential malalignment of the joints may have an effect on the tightness of the thoracolumbar fascia and may affect the shoulder. Or you may have a situation where tightness in the muscles of the lower back may cause tightening of the thoracolumbar fascia, which may affect the lower back and then the shoulder. It's a question of what came first, the chicken or the egg. I'm not too sure in this case. So what I'm going to do is I'm going to work on releasing the tightness in these muscles, and I'm going to reassess his muscle strength, and I'm going to see if it makes a difference. All right, let's get going. You good, man?
Yeah, I didn't fall asleep.
You didn't fall asleep?
Yeah.
Okay, yeah, that was pretty boring. All right, guys, don't forget to hit the like button, subscribe, and hit the notification icon. We are dropping content weekly your support will be greatly appreciated. Okay. So, what I'm going to do today is just work on this right side and see if we can have an effect on the strength. So how's the training going, Stan?
Great.
Yeah, what did you train yesterday?
Yesterday was chest and biceps, and today, right away after this session, I'm gonna train back.
Nice. So maybe you'll be able to tell us if the treatment had an effect on your training as well.
Okay.
What exercises are you training for back?
We will see, but it's probably gonna be lat pull downs, barbell rows, you know, some kind of machines. I will figure that out.
And what's happening in terms of competition prep?
Well, right now I'm on bulking, so it's 8th week of my bulk process. So we will see when I'm gonna pick a competition. It might be this year or it might be next year. I will have to decide.
And what weight are you looking at going up to?
Well, at least 110, and right now I'm 105, so
You got another 5 kilos.
at least, right?
Yeah, and how much of weight are you picking up weekly?
Around 1 kilogram.
Around 1 kilo.
Yeah, but it's a quality weight. I don't want to put any body fat or water weight.
So how many meals are you eating a day?
Every day 6 meals.
6 meals, eh? How many calories?
Well, it's around 4,500. Yeah.
4,500, man.
Yeah.
That's like 3,000 more than what I'm eating at the moment.
I know, you're on a zero carb diet.
Yeah. Yeah, so it's probably good for us to shout out our coach at the moment, Andy Bell, Andy Bigger. We'll drop a link for him probably somewhere here or there. Go check him out. He won Arnold, Ohio and Arnold, Australia. I've been working with him for probably about 4 or 5 months now. I dropped about 26 kilos, and Stan here has put on quite a bit of weight. So he's been working well for both of us. How's that? It's okay?
Yeah.
Not too strong?
Yeah, you're strong, man.
I'm strong.
Yeah.
Well,
I'm pushing you way too hard.
Yeah. Stan's been pushing me quite hard at the gym. Yesterday was legs. It was a killer day. Today is my off day, so
I gotta get back at him.
yeah, I gotta get back at him. Yesterday he killed me on the legs, man. Okay. So, Stan is training. Recently, we dropped a video. I can't remember who it was with, but a person commented and said, I hate when a chiropractor says, or physio says, I'm not going to go too hard on this guy. And the person said, I just want someone to bury their elbow into me. Look, deep tissue massages are fantastic, but there's a time and place. Stan is obviously training today, and he is in a prep phase. Even though it's bulking, it's off season, we got to do things at the appropriate time. He's in for a tune-up session. He's not in for a breakdown session, you know. We're not here to break all that scar tissue down and loosen up all the fascia. We just want to do a small tweak. So I am not going to go too hard on him today. I just want to loosen it up to see if we can have an effect on his performance. And I just want to see if we can have an effect on the muscle testing to see if it improves. If it does, then this may be the way we go with him. We may get him to see our massage therapist for some deep tissue to work on these paraspinals and the thoracolumbar fascia, and see if it has a further effect on his performance and strength. So you're going to go easy. Today's my off day, by the way. Are you going to go easy with me tomorrow?
Of course not. I'm never going easy with you.
All right. Okay. So. So I did some release of the paraspinal and the fascia. Nothing too hectic, nothing too fancy. What I want to do is test or check his leg length and see if it's changed. By releasing the fascia, has the pelvis and the lumbar spine repositioned itself. Look at that. That's all it took. It was just a little bit of loosening up. Okay. Can I get you to raise your right leg from your hip for me, please? Okay. And down. Left leg for me. Up, up, up. High as you can go. Look at that. Equal. Relax. Let's test the trap median. Can you sit up for me? Bring this arm here. Okay. Okay, I'm going to push forward. I want you to resist, okay? 1, 2, 3, go. Go, 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 go. Feel the difference? Lift up. Hold for me. I want you to resist me. Go, 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 go. Look at that. Okay, so what's happening is he's able to lock out immediately. There's no break in the connection between his brain and the muscle. It's not sort of reducing muscle power over time. Let's get you to lie on your back for me, please. There is no inhibition. All right, let's do the pec now. Okay. Hold for me. Hold, hold. Look at that. Much better. Relax. Down for me. Down, 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 down. Now the lat, hold. All right, push in. That's great. So the lat wasn't too bad. How I know there's a difference is I can feel the muscle shaking and a lack of tremor in the muscle when I do my muscle testing before and after. Now when I'm testing him, he is not trying to compensate using all his oblique muscles and his serratus to try and fire up that lat. It's just purely the lat. Let's have a look at the right leg now. Raise your leg for me, please. Hold. All right, I'm going to push down. I want you to resist. Resist for me. Resist, resist, resist. Much better. There's still some mild inhibition. Not too bad though. Turn your foot out. Hold for me. Hold, hold, hold. Much better. All right, I'm going to push out. I want you to resist for me. Let's go. Go, 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 go. Look at that. It's much more difficult for me to move him across. Do you feel the difference there?
Yeah.
I'm not pulling you across like I was earlier. Let's try one more time. Let's go. Go, go, go. Look at that. Much better. Okay? Let's get you to turn onto your side for me, please. You're going to face that way. On your side. Okay. Let's check out the glute med. Bend your bottom knee for me, please. Okay. Roll this hip forward. Roll your hip forward. Bring your leg back. Hold for me now. I'm going to push down. Hold, hold, hold. Oh, yeah. Feel the difference now? Mm-hmm. There we go. Okay. All right. Let's get you face down, please. Okay guys, so that's the difference a little bit of soft tissue can make, but also just having a good idea of how the body functions as a system. It's very easy for us as chiropractors to say, oh, it's coming, patient's muscle weakness is as a result of joint dysfunction. I'm sure there's a lot of you out there go to your chiropractor and says, oh, your leg, one leg is shorter than the other is because your pelvis is rotated. Okay, it's fine. That is a great example of why that type of dysfunction can occur. But sometimes we have to have a greater look or greater understanding of what's happening in a body, especially in a high functioning athlete. All right, so when it comes to bodybuilders that are having lower back pain, one thing that I love to do is decompress the lower back. All lifters have some type of disc injury. I am certain of it, whether it's a degenerative disc or like an acute disc sprain. I personally believe, based on the amount of lifters that I've treated, bodybuilders, strong men, strong women, power lifters, they have something. So I always use decompression as part of my treatment protocol. I think it's absolutely fantastic. Let's get you to drop back for me a little bit, please. Back, 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 back. I've been seeing a lot of comments on my videos talking about chiropractic being a pseudoscience. Guys, what I do is very much science orientated. It's evidence-based practice. Go and have a look at journal articles on thoracolumbar fascia. Go on the thoracolumbar fascia. Go and look at articles on joint dysfunction and arthrogenic muscle inhibition. The literature, it's pretty evident that it's in the literature, okay? All I'm doing is I'm using chiropractic as a means to address these issues that patients have, okay? Okay. You good, man?
Yep.
All right. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. And relax.
Yeah, I can really feel it.
You can feel it?
Yeah.
Feels good.
Yeah.
So when you're going to teach me to pose?
Oh, sure. You must know it.
I must know it. When you're going to teach me?
Whenever you want, man.
Whenever I want.
Yeah.
Inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale and relax. For you guys at home that want to get the effects of spinal decompression, if your gym has a reverse hyper, it's a fantastic way to decompress your disc. I truly believe that all lifters should be using the reverse hyper. If you want to check out a video, go and look for Louis Simmons reverse hyper. There's no better person to learn how to use the reverse hyper from than the person who invented it. Louis Simmons, Westside Barbell, he's a legend. Inhale and exhale. 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 And relax. I know this guy doesn't stretch because we constantly talk about stretching. He constantly tells me he's feeling tight and I constantly tell him to stretch and he doesn't do it. So before I adjust his lower back, what I want to do is stretch out his quads and his hip flexor. It makes it easier for me to manipulate him as a patient because these tight legs are going to affect my ability to move his hips and set him up for an adjustment. So we're going to do some PNF stretching. Relax your hip for me. There we go. All right. What I want you to do is just push into my shoulder with your quad. Push in, yeah. And relax. Okay. Drop your foot down. Right. Lift your foot up now. Lift, 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 lift. Okay, push into my shoulder, push hard as you can. Rest, drop down, come back for me, all the way back. Okay, push into my shoulder. Rest and down. Okay. Stretch out his hip flexor a little bit. You okay?
Yeah,
I'm not putting too much extension in your back, or am I putting any extension in your back?
it's okay.
It's okay. You feel it in the hip flexor?
Yeah.
Okay, what I want you to do is push down. No, down into my hand. Yeah. Down. Yeah. And rest. Lift your leg up. There we go. Hold. Relax. Relax now. Push down. Rest. Lift up. There we go. Push down. And rest. So if you guys want to find some tricks to stretching, not everyone loves stretching, go and check out PNF stretching on YouTube. Go search the term PNF stretching on Google. It's a great way to get the most out of the muscle without having to stretch it for a long period of time. You can see here there's not much laxity in that quad, right? But watch how easy it is for us to get his heel closer to his buttock. Okay, push into my shoulder. And rest. Straighten your leg. Come up again. Relax, relax, relax. There we go. Push in. Rest. straighten, come up again, push in, rest, straighten. Okay. Now look at that. It's a big difference from here to here. Okay. Let's work on that. Psoas. Okay. Push down for me. Rest. Down. Lift up. Yep, up, up, up. 1 second, 1 second. Let's come in a little bit. Relax your back. There we go. Right, push down. Rest. Down. Lift up. Okay. Let's go. Down. And rest. Okay. All right. Let's get you to turn onto your side for me, please. Face this way. Let's see if we can adjust this big guy. Come to the edge for me, please. Bring your hips to the edge. Come, come, come. There we go. All right. How's that? Doesn't feel so tight in your hip, eh? Just a little bit. Okay. Give me this arm. Let's pull through here a little bit. Okay. Let's place that hand there. That hand there. Oh, here we go. Inhale, exhale all the way out. As you exhale, let this knee drop. There we go. You good? Okay. Let's get you to face that way. Come to the edge for me, please. Come, come, come. Okay. Roll onto that shoulder. There we go. Bend this knee. Okay. Give me this bottom hand. Turn for me. There we go. All right, look up, look up. Let this knee fall, roll forward. Roll, 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 roll. Okay, inhale. Exhale all the way out. You good? Yeah. All right, on your back for me. Let's get you to sit up. Whew, that's hard work, guys. Hard work. Let's get you on your back, please. Cross your arms. You know Franco Colombo was a chiropractor.
Oh, really?
Yeah. Lift your head up for me, please. Inhale, exhale. Inhale, exhale. If you're good, drop your head back. Turn your head to the right. Inhale, exhale. You good? All right. Okay. Bend your knees for me, please. Okay. Please rest your hands. Rest your hands. Leave your head loose for me. Okay. Inhale. Exhale. Relax. Inhale. Exhale. You good? Great. Okay. Sit for me. Swing your legs over. So the one thing that I want to check is range of motion. Can you cross your arms for me, please? Okay. Can you turn to the left now for me? As far as you can go. Look at that. Okay, we'll try and put a comparison of rotation to the left before and after, but Stan was kind of getting stuck about here. Now he's able to go all the way. That's what a big difference working on the thoracolumbar fascia makes. Go to the right for me, please. As far as you can go. Great. Okay. Bend to the left for me. Much better. And then to the right. That can still be improved upon, but much better. Okay. You can rest. Okay guys, that brings an end to our session today. Very different to what you're used to seeing on this page. We use no needles, no electrostimulation. We did not treat the weak upper limb or the weak lower limb. All we did was some soft tissue mobilization on the thoracolumbar fascia, and that made a world of difference. So I will probably continue to see Stan in the next couple of months. Look out for our next video with him. Do you want to share with our viewers where they can find you on social media in the event they want to do some one-on-one coaching with you or some online coaching?
Oh yeah. If you're serious about your goals and you want to transform your body, get in the best shape of your life, you can send me a message on my Instagram and let's start to work.
All right. We will drop a, I guess we'll drop in a link to your Instagram in our captions below. You will find it somewhere there. Okay guys, if you have any questions on anything that we discussed in today's session, please drop them in the comment section below. If you are a professional athlete or semi-professional athlete, you're looking to go pro and you have some type of issue or no issue at all, and you have any questions or you'd like to see me, please drop it in the comment section and I will be sure to respond to you. All right guys, until next time, cheers.